bone loss comes from mature bacteria that's trapped underneath the gum. So again, most people can brush really well, but the battle for bone is under the gum. I mean, you can't get your toothbrush this far underneath your gum, and the bacteria is trapped there, and for some people, they lose bone. But bone loss is sneaky and silent. There's no pain with bone loss. So people don't figure it out. If you had a leaky filling or a little bit of decay, you know, it starts getting hot and cold sensitive, sweet sensitive. Maybe you're packing food in there, it's rough to your tongue. You've got several ways of knowing, wait a minute, you got something going on. With bone loss, it's not like that. They never sense it until they have mobility. So then the patient shows up at my office and they always say, hey Rick, I think I have a cavity. Can we take an x-ray? And we take an x-ray and we see this pristine tooth that's never had a filling and no decay, but it's got advanced bone loss. And I come in the room and I ask them their symptoms, and they always tell me the same thing, that lately when they bite down on something firm like a piece of steak, that it hurts. So we can't, even with surgery, add bone back. So the bad news is, okay, they're going to lose that tooth. But the real bad news, it's bacterial. The rest of them are not that far behind. So we love it when we can intercept people and teach them, hey, you know, it needs regular cleanings. Because it's bacteria, it's kind of like washing your hands. It's never done. Maintenance really pays. And I tell people, hey, pay me for extra cleanings. I do implants. You know, I make a whole lot more money doing an implant on you. Pay me for extra cleanings so we never have to get there in the future.